Nearly 300 years ago, religious sisters helped lay the foundations for healthcare in our country.
Religious sisters in the United States have a very unique history in healthcare. At a time when women were not in the business field and religious women were barely allowed out of their convents, Catholic religious women working with a few doctors and nurses built the largest and most successful private healthcare system this world has ever known. That is an incredible testament to the power of women, most of whom were nurses. Even when you don't have all the tools, but you are committed to doing whatever you can to help, you can make a huge difference.
These early pioneers were innovators. They brought a different perspective to their work. At the cutting edge of healthcare, it was religious sisters who were involved in founding New Orleans' Charity Hospital in 1736, the second oldest hospital in the United States. These same sisters treated malaria and yellow fever in slave populations when it was not politically or socially accepted. Nuns had a commitment to healthcare and social justice. Catholic hospitals were open to all, without discrimination. This spirit of innovation continues today.
If we're going to innovate, we have to be able to see clearly, but also see differently, and that gives you a different perspective. You don't always look the same way with the same amount of light and the same amount of scenery. You have a way of looking through and say, you know, there's another way to do this. To see through to the next advancement. But to do that well, you have to be deeply rooted in who you are, why you are, and what are the non-negotiables.
A non-negotiable for these sisters was their focus and commitment to the patient. They placed an emphasis on human dignity, care for the poor, the sacredness of life, justice, service, and compassion.
I think the most important lesson from the sisters and their experience in starting out in small, dismal little houses, and they're turning into giant medical centers, is focus on the patient and be collegial. The focus was always, what does the patient need? Most of the time we came because the patient needed us. They weren't getting the care they needed, or the care was exceptionally substandard. And secondly, be collegial. The sisters didn't do it by themselves. They worked extraordinarily closely with physicians and with other nurses. And that collegial effort at patient needs being met with high quality is what drove the success of Catholic healthcare and is what will drive the success of healthcare in any forum today.
As we face new challenges and opportunities in how we provide healthcare, we can learn from the commitment of these early pioneers and innovators. Their vision, focus, and commitment to the patient are fundamental principles that continue to guide us today.
We have to have a vision, you have to be with others, you then have to understand how we can change things and make it better than it was, and then have the ability to inspire others that they can carry it forward. So that's an individual nurse. It's an individual person and within healthcare. It is the profession of nursing. That was the core where it all started.